You have bacteria living in your mouth, and as an adult, you don't get a new set of teeth. This is what you get, so you have to keep the ones that you have now. Today I'm going to be talking to you about how to take care of your mouth and why it's important. I've been researching oral hygiene, including bacteria and diseases, for 4 years. I'm going to talk to you about diseases and how to keep the oral cavity clean and free of diseases. I've worked with Dr. Nilay Patel. He's been practicing dentistry since 2005, and he's taught me a lot about periodontal disease, or diseases in the mouth. A periodontal disease is a serious gum infection. It can destroy the jawbone. A periodontal disease is preventable, but it is not curable. You can't reverse it. You can treat periodontal disease and maintain it. Once you have this disease, you have it. Now, the way to treat periodontal disease is to get a treatment done called scaling and root planing. Now, scaling and root planing is where the hygienist goes in and removes the calculus from in between your teeth that's down at the bone level that's causing the bone loss. Because periodontal disease is a bone disease and a gum infection. Calculus is plaque that is hardened or calcified, and that gets in between your teeth and, like I said, the bone, at the bone level. And to help maintain this disease, it all is regularly going to the dentist after you get this treatment done every 3 months. They have you come in every 3 months to keep those areas clean, check the pockets of the areas there to see where your bone levels are at, so they can make sure that this is working and strengthening your bone. You also need to have a good home care as well. Now, the oral cavity is around your heart, your lungs, and your brain. So you need to make sure that you do keep this area clean and free of diseases. Now, if you already have a heart disease, you need to maintain your oral hygiene, because if you end up getting periodontal disease it is a buildup of plaque that calcifies and hardens. And once you have a buildup of plaque, it narrows your arteries. Once it gets to your arteries, it narrows your arteries and decreases blood flow to the heart. And that can cause many more issues. It can also affect your family. Now, and it's not contagious, but there's bacteria that lives in your saliva. So if you transfer your saliva to a family member using a utensil or kissing, they now have bacteria in their mouth and can lead up to periodontal disease if they do not take care of their oral hygiene. You can also have gingivitis. Now, gingivitis is in your gums. It's when they're red, they're inflamed, they're swollen and puffy, they bleed. Now, you need to make sure that you take care of gingivitis as well, because if not, it can also lead to tooth loss and periodontal disease or other serious conditions. Now, to how to keep the oral cavity clean and free of diseases. According to Oral-B, oral hygiene is the practice of keeping one's mouth clean and free of diseases and other problems. Now, to do that, you need to regularly brush and floss. Brushing, you need to brush twice a day, once after breakfast and once before bed. Flossing once a day can expand the life expectancy of 60 years. Excuse me. There's 36% of plaque that's left in between your teeth that the toothbrush cannot reach, which is why it's so important to floss every day. And to get regular checkups with your dentist, it's very important to have regular checkups with your dentist. That way they can evaluate your health and your oral hygiene, make sure everything looks good so they can help prevent you from getting these diseases. And to quit, if you smoke or chew tobacco, you need to quit those habits, because those increase your risk of having gum disease and cancers. You need to quit those habits because it can cause gum disease. If you want to take care of your oral hygiene, Get rid of those habits. Brush and floss. So, in conclusion, oral hygiene is very, very important. Diseases, how to take care of diseases, and how to maintain your oral hygiene to prevent diseases. Now you know more about how important it is to take care of your oral hygiene. You need to start to floss and brush effectively and regularly. See a dentist regularly, at least twice a year. If you smoke, quit those habits. You are in control of your oral hygiene. Take care of your oral hygiene. It will also prevent you from having bad breath. So keep up with your oral hygiene.